I had my stroke January 7th, 2014. Since I've had my stroke, it affected the left side of my body. I can't move my left arm. I just recently got movement back in my left leg. And my left side vision is blurred. When I first came to Christ Medical Center, I couldn't sit up on my own. I couldn't eat on my own. I couldn't swallow. I couldn't walk. I couldn't talk. I was drooling on the left side. Today, I'm in Christ Rehabilitation Center. Well, I'm working with occupational therapy, physical therapy, speech therapy on ways to get back to normal.
Felicia is a 43-year-old African-American female that suffered a stroke 6 weeks ago. Her stroke was rather large, and it was in the right side of her brain, which affected the left side of her body. When she arrived to us, she could not hold her head up. She was unable to control the muscles in her left arm and her left leg. She was unaware of her deficits. She had poor insight, poor safety awareness, a left-sided inattention, meaning she didn't recognize the left side of her body. In the 5 weeks that she's had on our rehab floor here at Christ, she's made tremendous gains. She's now sitting up on her own, she's feeding herself, she's standing, she's walking, she's dressing herself with some assistance, and continues to make gains every day.
Felicia, when she came here, had very little movement in her left leg. She only had a little bit of movement in her hip. So as a physical therapist, that's very challenging because your goal is to walk, and so you need your legs to walk. So we worked really hard on making sure that we were strengthening the leg. Her family played a huge role in that. She was one of those patients that you gave her exercises and she did them at night. And so that was one of the biggest strengths that I think Felicia had. But with the challenge is that she was just very weak and not aware of her left side. So it was a lot of focus and working with her to really pay attention. When she started, it took 3 of us to walk her, and now she's walking with just her husband. So she's made a huge gain.
One of the most remarkable things about Felicia is that on the very first day that I met her, she asked me for homework. And people don't generally come into speech therapy and ask for homework, and she blew me away and was like, I want some homework, I want something to work on outside of therapy. And this is after 6 hours of therapy, or 6 hours sitting in the wheelchair. She's like, hey, can I have more to do? So, and she's been like that throughout her entire stay. She's constantly asking, what else can I be doing? And that is one of the testaments of why she has done as well as she has. She's just been an exemplary patient, and she's just a wonderful, wonderful patient.
Strokes can occur in anyone, any age, any demographic. It's getting to the hospital in a timely fashion, knowing those signs and symptoms of stroke, and just working hard, listening to your therapist, having an optimistic attitude.